am Dr. Anu Mehta, and today I'm going to be talking about women today in 2022 and mental health. First of all, before I begin, I want to say thank you to each and every one of you, because to come back and restart everything again after 2 years is a very, very big thing. And in person standing here and talking, it's like really like a dream, because last 2 years, first I need to thank the universe that I'm still alive, kicking, and everybody around me is also fine and absolutely okay. Plus, to see familiar place people and familiar place kind of means coming back home. And so many of us don't get that opportunity in our life. So it's a very big step for me forward into my future and into everything else. So why women today and why 2022? I felt that the last 2 years, during the COVID, people have gone through a lot. And women have always been that one part of the family who have labored always and have never been accounted for. Yes, today a lot of women are working, but most of the women were working from home because everything shut down and something systematically changed. So I will come back to that a little bit later. Let's park that, what's changed. Let's first look at what is mental health and why combination of women and mental health. When we talk about health, we often think health means only exercise, eating good, and but we never really look at the life incidents that are happening around us and how those incidents have an impact on us. For example, let's say during the pandemic, that's probably still parked itself, but maybe not over, maybe it's still over, we don't know. But it feels like men and women, and I cannot talk about women alone because men are very much part of the woman, man, right there. It felt as if whatever was going on in her environment, whether the man was now without a job because of the pandemic, whether he was sitting at home and working from home, something that he had never done before, she needed to be that one soldier who was prepared for everything and behave as if nothing is going to impact. Businesses shut down. And she had a smile on her face. Men were grumbling at home. She had a smile on her face. Children were sitting at home and grumbling. Mom, nowhere to go. And she was the entertainer who was looking after them and saying, don't worry, all is well. Somewhere, she was the soother who was going on with her life, no matter what was going on around her. So I want everybody to know mental health is a beautiful science that helps us to understand why someone is how they are, including their health. And could it be possible that these incidents that have happened in the last 2 years have virtually changed a woman's psyche? Could it be possible that the woman 2 years back and woman today is not the same? I don't know how many of you felt it back home, but I didn't feel like buying more clothes. I didn't feel like buying more clothes.
Oh, same.
Same, right?
Same thing, nothing new. Old. What is old only?
Yes, very nice. Nothing new I felt like buying. I had 10 dresses outside and I was very happy with them.
Same here, 10 dresses. And one shoe.
And one shoe.
Everything locked into the cupboard.
Everything locked into the cupboard.
Exactly, absolutely.
With the tags. With the tags. I suddenly looked into my cupboard and I said, what was I doing? Why was I voting for who?
But where to go?
And where to go?
Where to go? That was the worst thing.
And that's the worst thing. So I want you to now think, when I have no place to go, whether it's a man or a woman, and a woman is supposed to be the nurturer of the family. She's supposed to, when people are telling her, I have nowhere to go. I think, how many people at home have had a problem where they actually couldn't walk after that? Because if I don't have the clothes, I don't even go and pick up my clothes. Our body also works on the same principle. I don't use a certain muscle, I don't use a certain bone, I don't use something. And over here, if I had nowhere to go, what did I need my legs for? What did I need my legs for? And if I felt trapped, as if somebody had kind of held me tight into the chair and said, you need to be at home because going out wasn't safe. I want you to now observe how many people may have come down with sciatica problem, stiffness. How many of you may have come down with the joint issues? How many of you may have, many people came down with paralysis? And why paralysis? Because two things were involved in that. The first conflict was, oh my God, I'm stuck in my chair. What is the need of these legs? Or what is the need of this part of my body? What's the need of this part of my body? And secondly, it is about, I feel separated. And who am I feeling separated from? From my workplace, from people I meet, from, when you're going to a workplace, it's not just a workplace, it's not about money, guys. It never was. And I understood that very nicely in the last 10 days of my life. It's not about earning money. It's about connections. And sometimes, when those connections are not there in the same way, you can't see them, you can't meet them. Ask yourself, how many people had an eyesight problem? How many people actually had their eyesight going worse and they needed a chashma after that? They needed spectacles after that. Somewhere, just like our clothes which were sitting in the cupboard, our organs were sitting inside our body, not being utilized in the way that they should have been utilized for whatever purposes we were going out for. Another thing that I noticed was, and something that I'm really, really grateful for, is sitting at home made me realize that we hadn't connected with our family people. Not in the way that we could have otherwise. Now again and again I'm bringing up a woman of 2022. She's supposed to be multitasking, she's supposed to be the tutor for her child, she's supposed to be the lover for her husband, she's supposed to be a nurturer, a cook, a cleaner, and what else? Educated person, and of course, she should look good, not a hair out of place. And yet, hair industry was going through a lot of stuff. I don't know how many people went out and had a haircut and how many people couldn't cover the grace. It was as if the masks were getting lifted from every place and people had to be in an authentic way within the house. Look at each other in a raw manner. I felt as if the woman, and I would say woman again, not just the man had got separated from his place of work, but woman had an additional member in the house to take care of. An additional person in the house to take care of. And if the man did contribute, in my experience, my husband helped, my child, my both kids helped. Yet, somewhere it did come out. ये मेरा काम नहीं है, ये तुम्हारा काम है.
But I am helping you.
I am helping you. मतलब अगर मैं झाड़ू लगा रही हूँ, मैं भी वैक्यूम कर रही हूँ, तो वो पोछा लगा रहा है, लेकिन लगाते लगाते रो रहा है कि मैं देखो इतना बड़ा ऑफिसर, आज मैं पोछा लगा रहा हूँ. Are you getting my point? And the woman in me was noticing this, and I sat down and said, I increased my value for myself. Now, if we look at a woman, and we are not just looking at a woman saying who is, per se a certain age. Let's look at the whole track of a woman in 2022. A little baby being born, she's also a child, a girl child. A girl who's teenager in 2022. And let's look at someone who is just got married, 2022. Let's look at someone who has gone ahead in her life. Let's say she's in her menopausal stage. 2022, what happens there? And let's go a little further and say someone who's become old. We're looking at a spectrum of women. So let's not start from our ancestors. Our ancestor would be someone 70-year-old. Let's say my mom is 70 plus. And when she interacts with me, I'm 50 plus. What is an interaction like even today in 2020? So, in last 2 years, and I'll be very honest, there were a number of times when I felt like saying, "But so मेरे 30 साल की शादी मुझको नहीं चाहिए." तो अगर पोछा भी नहीं लगा सकते तो मैं क्या करूँ? You got it? So मेरी मम्मी जो 70 odd years की है वो मुझे बोलती है, ऐसे तो होता ही है बेटा, छोड़ने का नहीं, निभाने का. You can't do this. It's a family. Children will get upset. I'm not just talking about me here. I'm talking about masses because the number of divorces that happened in last 2 years were very, very significant. And it has impacted the woman and what sayings that are going on. And there were times in 2022 that my mom, who's 74, learned to use technology. So the woman, no matter whether she was 70, 80, she had no choice but to learn how to use her phone properly, how to use her laptop properly. And I was like, oh, my mom's sending me a message.
Yeah.
I can't believe it. She would sit every day hearing my lectures that I was doing online. Every day, her presence there was so supportive. It was like, मैं झाड़ू नहीं लगा सकती तेरे लिए, मैं पोछा नहीं कर सकती हूँ, मैं कुक नहीं बन सकती हूँ तेरा, but I can be holding your back. We just crossed Mother's Day. And I can tell that it doesn't matter what age of the woman is in 2022. Women have supported women massively, beautifully. Even when I'm saying this, I can tell you the completion that I've got from with my mom and the kind of strength that she gave me in this 2022 was remarkable. So, if she 70 plus could do that for 50 plus, what did I do? What did I do to it? I was somebody who was doing lectures like this, not online, not online, but offline. And suddenly we had to transit and even for health library, send everything online. I tried to sit down and say, am I going to get paralyzed now? Am I going to tell myself I can't do this? The work is going on, the work is mounting up at home. I started lectures, and very interestingly when I started lectures, I got people who were, you have a fancy idea of muting people on Zoom. In real life, we can't mute anyone. In real life, I can't mute anyone. But over the Zoom, we have a facility of muting people. But to be really honest, anytime that people were not muted, there were cries in the back. There were people fighting. And in my experience, my heart reached out at that point to my son first. Because those screams probably reflected the screams that were inside me but not coming out. Because we love to mute our screams. We love to tell ourselves, all is well. During this transition period of like last 2 years where I became so used to online, and I got so used to seeing myself in front of the Zoom right there, that today when I can't see myself, I'm thinking, where am I? You see, it's a transition. For 2 years, I saw myself with grey hair, with me coloring my hair, with parlors opening, with me looking at my wrinkles, with me looking at me aging, and admiring that no matter what happened, I tried staying consistent, and I tried holding my kids together. My kids gave exams online. They started from home. I'm very proud to say that they passed and they got into whatever they wanted to. And yeah, I'm really, really happy. I was holding a community, which was a community of people. So my mom was giving me support, and I was giving support to a community which was as old as her. And that's my way of giving back what she was giving me. The flow was going on more than anything else. In these 2 years, I went through many menopause, and which is where mental health came in. No matter how old I was, I couldn't ever believe that there is something called menopause. I actually made the slides, and I somehow feel that maybe they're not required, or maybe they're required, we go back to it. But because I want to address like every sector, so I want you to again observe. Eyes गई, टांगे गई, स्किन गई लोगों की, बालों की बुरी हालत हुई, नेल्स टूटे, हाँ, और ये सब क्यों? इसके साथ साथ this is outside. What about the internal, the woman's ovaries? What was happening there? Did I not feel loved enough in these 2 years for me to shrink my ovaries? What was going on here? And if you look at the word ovary, it's like I worry. And it's over. It's over when you don't have love. The game is over when you don't have love. So somewhere, I realized that the agony of the people, sometimes it's not that things are happening to you. Sometimes the things are happening even to the other ones outside. It can have a huge impact on them. I'm going to be working on you, and maybe let's see if we can integrate your life right here into the whole story, because if for the last 2 years you've been suffering from that, we need to look at what was happening around that area of the right leg, which was really, really not fine with you, Vinny. So we look at that. But what I really want everybody to get here is, if we think that life is going to just go on despite everything going ulta in the environment, then we are really mistaken. Did diet change for people? Did your exercise change? Which changed what? Stop. Thank you, it stopped. People were scared to move out of the house. It stopped.
Like, I thought life has come to a standstill. Nothing to do. We couldn't do.
It was like a phase of dead, everything is ending.
Exactly.
And that's how everybody posed, everything is ending. Now coming from 50 to people who are just getting married. Imagine you're getting married. Let's take the frame like this. You're getting married. Yeah? And you know, many 50 se aage aate hain ki people are getting married. Now people are getting married, what do they want? Do they want to be locked up in the house? Nahi, shadi. Do they want to be locked up in the house? Actually, they won't mind.
They're babies.
They're babies. But they wouldn't want to be doing tharu, pocha, because maids were not there, and it was very interesting for the Indian Janata, which was used to a maid always and someone doing it for you. Things were different. In my experience, the 20 plus who got married, and who were at home, working from home, didn't have enough place. I think Bombay is, from where I come right now, Bombay is a place where you don't have even a place sometimes at home. We're like living in matchboxes to even sit down and kuchiku with each other. And here, you're going to be living with a family maybe, and you really need to make your adjustments. And you really need to do fast adjustments. And there were girls who were not allowed to go back to their mom's house. There were girls who couldn't connect with their immediate family for, they couldn't see them other than the video call. You couldn't touch them. And even if someone was falling unwell, you couldn't move. What happens to those couples? In my experience, let's not even look at what happened to the inside of the body, but what was happening to the psyche. Husbands and wives could not get along. I have seen so many marriages falling apart. So now comes my mom's advice. 70 plus saying, "Pretty, hold on, things will get better." This is not a permanent phase. And I'm telling to some people, hey, hold on. Hold on. Things will get better. And in your little way, you're trying to make things better. But I have to admit, I cannot stand in your shoes. You cannot stand in my shoes. My mom cannot stand in my shoes. And in this comes a generation gap. My mom didn't understand. And so I don't feel understood. And for many, many people, now notice, how many of you put on weight during that time? You know why? Because we didn't feel understood. And holding the house. Holding the house, eating, but more than anything else, it's what you feel like a fish out of water. You feel like there is nobody holding you. You feel like a refugee in your own house. You don't feel connected. And all this, when we, in evolution, we were all sea animals. Eating fishes. Okay, so when we evolved, we came out of the water. We came on the land. But before we developed gills, from the gills to the lungs, we were transiting. Gills, lungs, gills, lungs. And in the story, if we couldn't match up and create the lungs, then Bichari Machli is going to swell up. So if I can't get my water, if I can't get the people I love, if I can't connect to people I love, what's going to happen to my body? It's going to, like a dead body, because we're going through a dead phase in their life. And the water retention in the body was increasing all the time. The bimaris were increasing, inflammation was increasing, the anger was increasing. And so much anger, so much people were inflamed. And the worst is, we pretend in front of our family members all the time. I think we are the worst with our family members than anybody else. In my experience, we can go and tell a stranger what we wanted to say. But when it comes to family members, in the pretext of creating harmony for our families, in the pretext of saying, everything is okay, we don't tell other people, even if it's small things, that you know what, you did this today and I didn't like it. Can you stop doing this? This makes me feel even more like fish out of water. Can you please help? Normal behavior is, oh, he told me that he can't do this, so I will do everything now. And we somehow shut our mouth, don't express ourselves. And this also collects water in our body because we are feeling like a fish out of water. Nobody to talk to, nobody to connect to. And that was going on even with the young couples. The second thing that happened, and this is really, really important, disorientation in our head. What do you mean by disorientation in our head? What's going on there? The disorientation is because I can't meet office people, that's one abandonment. I can't connect with my family at home, second abandonment. I can't connect with my children because they want me to be their teacher and I'm not their teacher. I can't soothe them down, I can't calm them down. And maybe number of things that you want to do, I can't do. And there were people who got stuck in the houses and couldn't move out at all. In this process, what can happen is you're sitting down and you're suddenly looking like this. You don't know what's happening. You go to the fridge to pick up something and you've forgotten. And you say, oh my God, I've forgotten something. That forgetting has happened because you're feeling like a fish out of water. So check out, did women and men in 2022 face this or not? And when you did go back to your workplace, suddenly again it's too much for you to manage. Another thing that got noticed is a lot of women in 2022 are suffering with what we call polycystic ovaries. Anybody heard of polycystic ovarian syndrome? What does that mean? Poly means multiple, ovaries which have become cysts. What is a cyst? A cyst is a covering, like a hard shell, like egg shell, around the place. Why is that shell happening? It's not soft anymore, it's a big hard shell. It means that this egg has become waste. ये जो अंडा है अंदर, ova means anda, that ova has now become redundant. It can't be utilized to make a child. So the ova is about the child inside the ovary. And when there was a big shock where people lost a lot of loved ones during this time, and if people were getting pregnant or they were around pregnancy hearing about a loved one who has gone away, this could create a lot of trauma on the ovaries and the ova of the woman and on the testes and on the fertility of the man. Not just that, when you are hearing people are dying, do you really want to make love or do you want to connect with your people who are back home and you are not able to move out of the house? I personally know of so many cases where young people, abortions, miscarriages, they couldn't hold the babies together. And I've heard of horrible stories of a 9-month-old baby stillborn. Why is that? It's because they didn't have that support. They couldn't connect with themselves. So how can your child connect with you? If I can't connect with myself, with my body, my child can't connect with me. So a lot of reproductive issues came up during this time, which men and women had to really deal with. Let's go a little bit more in the back. A teenager. A teenager who's going through massive changes in his life. What are these changes that are happening? Estrogen at one point, bubbling away, on the other side, testosterone. So the woman is becoming more feminine. She's now developing her breasts and everything, and she's looking very pretty because she's becoming a woman. And a boy is becoming all handsome and rugged and tall, and he's changing his voice, and you can make out that he's a boy, and he's got this attraction going on. During this time, he would be actually in college. He would be actually sitting down, and people would be looking into each other's eyes and smiling and flirting, and that would really increase the estrogen and the progesterone on one side and testosterone and the androgens on the other side, and keep people in a nice flirtiest mood, which is required. It's a great space to be the perfect woman and the perfect teenager and the perfect man on the other side. Now, during the pandemic, the boy was at home. His papa is saying, "Kya kar raha hai? Padhai kar." Nanu is also at home, Dada is also at home. Every family member is at home. Is he going to feel comfortable enough with his own sexuality? Similarly, the girls were also going through their own process where mom is saying, "Padhai karo," everything is online. We don't know what's going on online, and people are trying to do their own stuff. A lot of women also probably lost a lot of men at home lost a male member at home or a female member at home. And this saga where a teenager has to grow up and become a breadwinner of the house suddenly and has to forget about studies or forget about his sexuality or how he's going to grow, is going to create a complete chaos in the system. What kind of chaos does that happen? Most of the people heard this. Ab kya hoga? So I got a call from a person who was just what, 20 years of age, and he says to me, I don't know what to do, I'm suffering from anxiety. I don't know what to do, I'm suffering from anxiety. My father can't go out and earn anymore because all the restaurants are shut. And I'm the next member of the family. Does that mean I leave my studies? I used to do a part-time job of being in the gym, but nobody comes to the gym anymore. If you are going to lose your livelihood at that tender age, and there are many younger than this who went through the same thing, what's going to happen to your reproductive systems again? What's going to happen to your anxiety again? Everything becomes miniature because now you're not required to produce more children. Why? Because we don't know how many are going to survive, so we are not required to produce people, we are required to survive in another way. And some of them will say, अरे survival के लिए ज़्यादा बच्चे पैदा कर लो तो काम हो जाएगा. But reality is that the food wasn't coming home, things weren't coming home, and the first shock that gives us, the less is better. The less is better than more is better. So children are not going to be connected to themselves in the same way. So I want to give you a little bit around anxiety. So check with yourself. Did you ever feel, and this is for all men and women, two things: powerless, very, very powerless, and that powerless is right over here. And the other center over here is the center of feeling something disgusting is happening. What's something disgusting happening? Yes. What was disgusting? That people didn't have their livelihoods, they didn't have things, they didn't have their life together, and in this they developed the anxiety. So these are the two centers. It's the frontal area of your body, frontal brain of your body, everything from front gets connected over here. Okay. So now when we go again to the kids, we don't have to go back to the kids because we are going back to the people who just got married and they are having children. And most of us, when right in the beginning we don't say, मुझे बेटी चाहिए, हम क्या कहते हैं? बेटा होगा. अगर बेटी हो गई तो पहले देखते हैं कि सफेद होगी, काली होगी, गोरी होगी, कैसी होगी. And that is created so much of flux in the system, it's not funny. What I'm going to do right now is, how much time do we have? 10 minutes. So I'm going to work with Mimi on her foot, on her knee. So you will get more idea about how this 2 years could have had an impact on her. And she is into a beautiful age bracket where I can actually work on her and see if we can relieve her of that pain. So would you please step in here?
And you will live when
Please step in the chair. I will pick up the chair. Yeah. But then,
you want to record it?
yeah,
Don't record. Please don't record. You do.
yeah, so we'll record it so that, no, I don't put that.
Yeah, you can record it.
So it's a right knee.
Yeah.
And when Nimi was sitting here, she was talking about how she couldn't do much of an exercise last 2 years, how she's been sitting with it. So could you just clap for me, ma'am? Just clap for me. Can you see that her right arm, her right, could you clap? So her right arm, her right hand is more dominating. And so we're also looking at the right knee, and we are looking at the dominance of the side. So when I look at, thank you so much, when I look at the right side, it means that something is happening around her husband, money. It could be to do with her inflexibility with her husband, with money, with some friend, with a sibling. So we'll ask her right now. Anything that was happening in your life in the past 2 years or 3 years, you said been there for the last 4 years, right? So anything that's happening in past 4 years, where you felt a certain person has been inflexible with you. It is someone you probably look at as an authority. Could be someone who gives you money, so he has again authority, or someone who's your sibling maybe, who doesn't let you do what you really want to do. Brother, your brother. Okay. So think of one scene around your brother where he's telling you specifically that you can't do this.
Yeah, he's telling me.
How does he say that?
You don't do anything. Forget it. You only talk.
Very good. So can you say that again? You only talk.
You only talk. You don't know. You ask me, I will tell you. I will show you on the Google.
Okay. Very good. I will show you on the Google.
Yeah,
You don't ask.
What you're
Okay.
saying.
Move your leg and see how it's moving. I'm going to bring his face. I'm going to bring your brother's face closer, 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 closer. Hear his words. Hear his words. Hear his words. Move your leg. Move your knee. Move your knee. Tell me if the knee is getting looser.
Yeah.
It is getting looser. Getting looser.
Pain is
Very good. Pain is reducing. Pain is reducing. Very good. Very good. Okay.
I had a fight yesterday.
Very good. So we bring that yesterday's fight closer. I want you to hear everything that was going on in that. We're making that guy really loud so that you can really hear the sounds of everything. Bringing his face right close to you. Move your leg. Tell me how much is the pain right now.
Gone down.
It's gone down.
Almost gone down.
Almost gone down. Very
Move
good.
my leg.
You can move your leg. Before that, very comfortably. Can we just take a leg so that it really moves? Can you move the leg and show us? Very good.
First, I couldn't do this much.
I know that you
The
could.
second,
Yeah. You opened it?
yeah.
Yeah. Very good. Now I just want you to again look at your brother right here. Your
It
brother.
irritates me.
We're going to get that irritation. Closer, 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 closer. And move your leg. Move your leg. There. Can you see the leg going higher? Yeah. Moving up, 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 up. How would you kick him? I was happy. Yeah. So thank you very much. So that's what we did. Now I want you to now
You know
think.
why I irritate with him? He's got cataracts. I insist he get operated. Who are you? Do what you want. I do.
Yeah.
That irritates me.
Yes. So
And you brought his yesterday's seed.
yes. So I just want you to last once more we just check. Yeah, if your leg is still opened up, oh wow. We can see that the leg
Has almost
pain
gone
has,
down.
pain has almost gone down, right? Almost
Yeah.
gone down. Very good. So brilliant.
Bandaged inside, it was tight, not as loosened.
It's loosened. Excellent. It's loosened. So one thing that you need to give up in this relationship, one thing that new that you need to start in this relationship.
What should I do?
You tell me, what's one thing new that you can start in this relationship? One thing that you can leave in this relationship?
I'll listen to him.
Okay, he's got cataract, hasn't he?
Yeah.
Which means he feels separated from you.
Yeah.
Rather than insisting on
He cannot see properly when he gets irritated.
yes. So his irritation is not with you. His irritation is because he cannot see properly. Can we get that to your understanding right now?
Yeah.
Wonderful. Get that into your heart.
Yeah.
That my brother does not have anything with me or against me. He just cannot see properly. And he's not against me, but he just cannot see properly, and so he does what he does. He's not angry with me, he's angry with himself. He's angry with himself because he cannot see properly. So this is where, when we understand things little differently, our body reflects a little differently. A woman of today can kick you if you like. And she really needs to understand what's going on in her space. So love you guys. Thank you so much.
Thank you so much. I'm feeling much better now. I'll go and help him.
Help Talks are daily health-related talks held at Health Education Library for People, Mumbai, India. For more information visit www.healthlibrary.com. Subscribe to Help Talks channel. Be better informed about your health.